Alrighty, we are going to get started. We have just 3 housekeeping notes for you. Attendees will receive a certificate of completion via email within 10 business days of this webinar. It is for 1 continuing education credit. It should transfer to your personal state licenses and certifications, but you must confirm this with those entities. If you registered for this event but are watching in a group through someone else's device, WebEx may not count you as an attendee, so just drop us an email at marketing@brightviewhealth.com to let us know. You will also receive a copy of the slides with your certificate. Finally, if you have any questions today, please ask them via the chat and we will try to answer them all at the end of today's discussion. Thanks again for joining us for our virtual forum, Millennials in Recovery, How Generational Recovery Can Unlock Better Care. We are pleased to introduce our presenter, one of BrightView's medical directors, Dr. Harithsa Asuri. Dr. Asuri?
Good afternoon, everyone. Thanks so much for joining. Thanks to Heather and the team and marketing team putting this together. My name is Harithsa Asuri. I'm the medical director at BrightView. Been with BrightView for the past 6 years. I've been very grateful enough to also complete an MPH while working with BrightView. So I'm grateful for the opportunity to have this talk with everyone and exciting to present this topic. Our agenda today is understanding this particular generation, challenges and patterns in substance use, the unique circumstances for millennials that we face, how to unlock better care, and then certainly we will open it up for further discussion and questions. So let's start off by defining the events of a generation. So millennials are defined as anyone born between 1981 and 1996. This represents currently 22% of the United States population. We have grown up with multiple events, as we can see here, internet and social media. There's more exposure to substance use. There's online peer pressure. And oftentimes the generation is found to go online to escape reality. Certainly we've been exposed to school violence. The constant anxiety and exposure to trauma has pushed some to self-soothe with substance use. Certainly the war on terror, many of us were early in elementary or middle school or even high school when 9/11 happened. I certainly was in middle school when that happened. So the trauma and fear of this time may have led to substances to cope with the anxiety and grief for many of our members of our millennial generation. The impact of the housing market crash. I mean, many of us now have mortgages as being older in this generation. However, many of the circumstances surrounding that was secondary to our parents potentially losing their houses or their jobs, secondary to the 2008 recession. And so we often found this generation having impact of economic struggles that led to hopelessness, increased vulnerability of substance use. And certainly after the recession or during the recession, substances became a way to handle the stress and uncertainty and financial struggles that we were able to observe in our parental generation as well. Smartphones, and the advent of the iPhone, which revolutionized really the world, easy access to substances and disconnecting from healthy coping habits has impacted our mental health. And then certainly the student loan debt crisis. Many of us took on student loans for better career prospects that went unrealized. Significant debts certainly now has delayed life milestones, and certainly this impacts mental health, which can certainly increase substance use. Next slide. Thank you. Millennials, again, a snapshot of a unique generation. If you can look at the graph above, it demonstrates the boomers from 46 to 64, which is the average age right now is anywhere 58 to 79, is 69 million people. Gen X, 65 to 1980, 43 to 58. This represents about 65 million. And then millennials, 1981 to 1996, 29 to 44, and it's 73 million, and then Gen Z from 97 to 2012, 13 to 28 years old, 69 million. And so we can see that we now are representative of the most populous generation here in the United States. Certainly, we are tech savvy and more connected. We're the first generation to grow up with the internet. We look for purpose-driven work that's meaningful and looking for that work-life balance. We are and try to remain highly educated, but certainly we are facing some of that financial strain. 39% of us in this generation have a bachelor's degree, and 32% of Gen X. 51% own homes, but we have about 21% struggle with student debt and versus the 12% of Gen X. Certainly, we try to be socially conscious. We advocate for equality, mental health, and activism in our workplaces, our schools, universities, and just in general as well. And certainly, we are nostalgia driven, passionate about reviving some of those trends and brands from our youth. I'm sure many of us, when we see certain things that perhaps our children are playing with, it certainly brings back those memories that that we had growing up. And this is prior to phones, that we were living our lives outdoors, or if we were playing with electronics, it was very restrictive compared to what it is today. Next slide, please. Millennial substance use trends. Certainly the college experience. I think that the hard partying, the binging was established as a social norm beyond graduation. The culture that was created was very alcohol centric, social media driven, certainly as the advent of Facebook, MySpace, for those that can remember that, Facebook, and then Instagram, and then certainly it goes into further like Snapchat and all the other ones that are now out there. And so this was glorified, I guess you could say, potentially also in a lot of the movies that were coming out during that time period, like the example is given here on the slide, American Pie, and Old School. And so we can see that in the millennial and alcohol and substance use in 2023, adults ages between 26 and 49 reported 46% of alcohol use, 21% of marijuana use, and 23.5% of illicit drug use. This is interesting because this is still greater than Generation X due to the rates of mental health issues and substance use issues in 2022, 40% of millennials and 21% of Gen X. Those statistics are quite fascinating. The top causes of millennial deaths, certainly the graph below, rate of alcohol, drug, and suicide in the United States in 2022 by age group per 100,000 and of the population. Certainly you can take a look that the bulk of this drug deaths, substance-related deaths, are 35 to 54. This represents about 59.4 deaths per 100,000 population, which far surpasses those in the generation after us, 18 to 34, and then certainly the one before us, our parents' generation and our grandparents' generation, of 35.2 deaths, and the 4.9 of 75 years or older. Deaths of despair. This term often refers to the fatalities of drug overdoses, alcohol-related illnesses, suicide, often linked with those with emotional distress, isolation, and economic hardships. In 2000, the millennial overdose rates involving synthetic opioids, such as fentanyl, have increased 500% since 2000. In 2017, 36,000 millennials died from deaths of despair, with drug overdoses being the leading cause. I just want to take a moment here of just highlighting on how severe the issue has been. And, as of the data from 2023, 2022, certainly, post-COVID era as well. I mean, we were reaching nearly 100,000 deaths This is all age groups, and I'm sure certainly if we did the statistics on that, it represented a large portion of those were also in those in the millennial generation as well. Next slide, please. The millennial makeup in general. So this is a great slide that shows a lot of different things. In the military, millennials still make up the highest percentage of those enlisted in U.S. military personnel. In 2016, this represented 80% of U.S. Army service members that were between the ages of 20 and 34. Marriage trends, it also is 57% of millennials have never been married, impacting access to spousal support systems. There still is a financial insecurity because many millennials begin their careers without a financial safety net, despite making up 35% of the US workforce and 22% of it globally. The health insurance gaps. So many of us were, under the Obama administration, were granted to have insurance until 26 years old. And we were allowed to be on our parents' generation until then. And then certainly, obviously, all of us are much older than 26, and now you have millennials that are less likely to have health insurance. 14% of those with 18 to 24-year-olds and 17.2% of 25 to 34-year-olds are uninsured in 2017. Now, this could also be impacted by those kids that are between ages of 20 to 26 with their parents experiencing issues as well, therefore not being able to provide health coverage for their children. Adults aged 25 to 34 are nearly twice as likely to lack health insurance compared to those between ages of 45 and 64. Risk of intimate partner violence. The highest risk of experiencing intimate partner violence occurs between the ages of 18 and to 24 as well. So next slide, please. So let's talk about BrightView. So here at BrightView, 31% of our active patients are Gen X, and 45% of our BrightView active patients are part of the Gen Y, millennial generation. And then you can look at it on the right side about the pie chart. 45% of the millennials, Gen X male is 17%, Gen X female 14%, and non-Gen X 24%. So about a quarter of our patients are non-Gen X either and non-millennial as well. Interestingly, you can look at the further breakdown, alcohol use disorder, those patients in Gen X versus Gen Y. You see that those are about 437 patients in millennial generation. The opioid use disorder is about 6,500 patients. Cannabis, 39. Sedatives are around 26. Stimulant, cocaine, 89. And then stimulant use disorder, 264, and tobacco, 21. So certainly, 7,500 patients or so that are active patients in BrightView. But majority of those, the bulk of those patients certainly are opioid use disorder when it comes to our BrightView patient markup. Why are millennials stuck? So this is an interesting question as well. There's an unrealistic expectations that sometimes are placed on us. Many of us feel pressure to achieve career success, home ownership, or relationships by a certain age, often seeing our peers accomplish these at a more rapid pace. Comparison to past generations, measuring progress against their parents' timeline that leads to self-doubt and frustration. And then certainly the societal norms that are changing, the traditional path of college, career, marriage, and then kids, and go along with that, no longer guarantee success, thereby increasing the stress and the uncertainty. And certainly the feeling behind in life that leads to self-doubt, anxiety, and feelings of failure. Now, this is, again, a very fascinating slide and question. Being part of the millennial generation myself, And having those patients come to me and talk to me about these particular topics, and then themselves comparing it to me, being like, oh, well, you're a doctor, you don't really understand these kind of things. That is not really, I would say true, because even those with successful careers and homeownership, we are also facing the same type of unrealistic expectations of saying, oh, okay, well, now that you have your college and career, you should be focusing on your family and achieving the familial goals as well. And so, because that's what the past generation wanted you to do or wants you to do. So certainly kind of leveling the playing field and kind of equating those conversations with the patients has been leading to a lot of success of them understanding certainly that everyone is suffering from these aspects of being stuck, and working together as a society to help each other, I think, is what's most important. And next slide, please. So addiction and among high functioning millennials. So again, this is a great topic as well. Functioning doesn't necessarily mean healthy. So high functioning individuals often excel professionally, socially, masking their addiction from loved ones or colleagues. Their success can delay recognition of their struggles. Many of this is demonstrated, perhaps more obvious on those that are in the financial career paths, that are always looking for a break and looking for higher returns for their clients. Uh, but oftentimes we find some of those patients that are deeply suffering from anxiety, depression, and other substance use as well. Uh, so therefore, functioning doesn't necessarily mean healthy. It's a hidden addiction. 20% of those with substance use disorders are high functioning, considering those struggles about managing those responsibilities. Like I just mentioned, it's just going on the same topic of those in the financial sector. Certainly, again, have to make those returns on investments for their clients, but again, are really struggling in managing some of those responsibilities they may have at home. If you bring it to the medical field, surgeons, psychiatrists, or any physician really, or any other medical providers certainly are always trying to deliver high quality care, and oftentimes are taking some of these stressors home with them, and oftentimes are not seeking the help that they desperately need as well, whether that be through therapy for their anxiety or depression that they're suffering from as well. Mental health has been a big issue, like I just mentioned. 40% of us millennials, are suffering from anxiety and depression, and we are masking it with potential substance use. And so again, then you go to social media. We oftentimes we see whether it be on Instagram or Facebook or any other platforms that are out there that give reels that are able to look at things very quickly, that show glamorization of lifestyles of success, and you process those images and you wonder to yourself, oh, why am I not like that as well? Which certainly can lead to the anxiety and depression, and from the social media pressures that's there. Um, and then certainly barriers to treatment. The time, responsibility, costly care limits the access to treatment. So again, it goes hand in hand. The societal pressures of having going to college and having a career, and then having a family, and having those job responsibilities or family life responsibilities, and then looking at the time of taking time for yourself that's next to impossible to do, or responsibilities because you're taking care of young children and you're neglecting your own health. And then this could lead to very costly issues later on in life if you're not able to take care of some of those things earlier on in your life. And certainly all of that certainly ties into relationships. How do you tell your partner that you are suffering from something like this when both of you are kind of in that same pathway of ensuring that you're able to remain high functioning? You're able to kind of continue on with the pressures from your job, or again, societal pressures. Do you really want to add something else to your partner's plate, because they may be suffering from the same thing? And so how do we really move the mark from that to have open conversations with your partner, with your and seeking treatment, despite it taking the time and it being costly and impacting others in your family? You really uh, should, and we really should work on ways of really tackling that appropriately for our generation and for moving forward. Next slide, please. So again, not what's the not so great news? Alcohol and millennials. It has become such a cultural norm that we have trends like wine mom, or I guess you could also say a beer dad or a beer or wine dad, whatever it may be. You come home and you're like, okay, yeah, I think I deserve to have something because I worked really hard, which ties into the whole work hard, play hard, which then normalizes this dependency that's created, that you are ultimately looking forward to something that may not be so healthy at the end of the work week. And so what other mechanisms can we use to ensure that we are appropriately treating essentially burnout, and what coping mechanisms can we develop? Certainly there's preference to premium alcohol because you grew up in a culture where you went to undergrad, you went to perhaps you went to a school that had a lot of a big party scene or whatever it may be. You were consuming beverages that were not the best. You worked really hard to get to a level where now you can afford those top shelf stuff that you always talked about when you were younger. But is that the right way? Is that the right mechanism to essentially cope with things? And I would say no. And so then you certainly have high rates of alcohol-related debt, um, whether that be sports gambling, whether that be gambling in general, because again, you are creating this dependency on alcohol potentially, and then you're also creating a cultural norm that it's okay to go and gamble, or on again, with the advent of uh, the iPhone and other smartphone devices, a lot of these things are readily available at your fingertips, and for people to participate in. Um, there's a strong connection between alcohol and social anxiety. The reverse can also be said, that your alcohol can cause social anxiety, and as well as take away some of the social anxiety. And so those that want to let loose a little bit and kind of integrate, it's very normal to do this. And certainly I think there's a huge impact of this from the pandemic. And the alcohols, there's two roles of alcohol that essentially were really highlighted during the pandemic and after. One is the alcohol's role in remote work. Uh, there were certainly companies that were moving their business models to remote work, which is fantastic. Perhaps it was a move because of productivity, and certainly because of the public health crisis that was going on. But there was still needed to be integration between the teams. So how would you do that? You would potentially host, these virtual happy hours, and people would bring their own beverages, and that's how you would kind of connect. You would consume an alcohol alone, essentially, but not really, because someone would be on the other side of the screen with you in consuming their own beverage. Now, is that necessarily healthy? One could argue probably not, because certainly once the happy hour ends, you are probably consuming more than what you normally would have. So again, it goes into deep dives into the social anxiety that's created because of that. That's one aspect of it. The second aspect of it is, well, once the pandemic restrictions were all lifted, the people wanted to get out and about again and wanted to connect again. I mean, that's what we all desire, right? Human connection. And so certainly the scenes, the bar scenes, the restaurant scenes, they were all having increased amount of people coming back. And so certainly kind of integrating the food and alcohol consumption again became more of a cultural norm and kind of the lifestyle that is being led currently. Next slide, please. What is the better news, though? The better news, despite what I just said about the consumption of alcohol in our generation, there is a reduction of those under 35 from 72% to 62% over the past decade. There is lower average intake of weekly alcohol among adults, declined from 5.2 from 2001 2003 to 3.6 between 2021 to 2023. There is also a huge move for non-alcoholic beverages. Millennials are consuming non-alcoholic beer, which rose from 45% to 61% in 2024. Many are looking for beverages that are give them the sensation of having something to look forward to. However, the caloric intake being not there, or even the actual alcohol not being there, so they can go on with the rest of their night or even in their weekend without being potentially dealing with the consequences of alcohol consumption. Next slide, please. This is a topic that I think is gaining more and more traction. Nicotine use among millennials. More than 1/3 of young adults, 18 to 34, reported the past month use of any tobacco product. While cigarette smoking in general has overall decreased, it still remains a significant factor. E-cigarettes has increased, so vaping. Many young adults also are using other cigarettes, e-cigarettes, and certainly transitioning potentially over to marijuana. Before COVID, some of the biggest research that was being done from the tobacco industry was the flavored tobacco. There was also a lot of research being done in the use of oils when it comes to vaping. Although it was marketed as a healthier alternative, they have found that there is significant lung damage even with those that are vaping. And so certainly here at BrightView, we are on almost every medical visit, we still ask about the nicotine consumption, whether it be via cigarettes, e-cigarettes, or more frequently now that's becoming more and more popular is Zyn. So tobacco-free, but they're nicotine pouches. So they are placed between the lip and the gum, or sometimes poured into cocktails or other drinks. It allows for nicotine to be absorbed into the bloodstream or through soft tissue. It's been available in the US since 2014. It's equivalent to 1 to 2 cigarettes in terms of absorbed nicotine. This is the most popular substance, I guess, that is among the millennials. It is addictive, sorry. It is and has significant adverse health effects, including cardiovascular and potential gum damage. It is it's just pure nicotine that people are adding into their drinks, like mentioned, and using and consuming this has increased exponentially. So there needs to be more approach in helping public health awareness for these particular campaigns for Zyn, and certainly even at the provider level, as well as institutions like BrightView, of really addressing this particular topic as well. Next slide, thank you. Millennial parents and recovery. So the stress and money struggles, parenting and financing, and just treading the water and keeping your head above the water. Substance use trends. Millennials are turning to cannabis, vaping, alcohol, and prescriptions. Parenting pressure, social media, and work-life imbalance. There still is barriers to recovery, regardless that are associated with cost and stigma. The overall impact on kids, the addiction affects families. There's still a generational impact. Perhaps the parents of the millennials suffer from substance use issues, and certainly that's what they grew up with. And so, whether it be the prescription medicines that were given to our parents' generation, opioid crisis, it relates to trauma or even delayed milestones, the hidden addictions, like we mentioned, the high functioning use, the wine mom culture, the digital risks that continue to exist, online access and social media, other barriers that include childcare or outdated care, or even parental care that we're providing for our parents, parenting struggles, disrupting the consistency and relationships, and certainly work challenges, the job instability and poor benefits that a lot of people are suffering from. Middle class families with two kids spend about 15,000 to 17,000 per child annually in 2023, accounting for a 25.6% inflation increase since 2015. And not only is it extremely stressful being a parent, it is has become extremely expensive as well. Next slide, please. Accessibility to treatment. So what are we doing? In a general speaking, what are we doing as a community, as a organization, as a country for accessing treatment? Digital options, value telehealth, mobile-friendly platforms, and online resources for convenience and privacy. Cost barriers, financial challenges, and insurance gaps limit access to treatment. So transparent pricing is very key, whether it be through self-pay or if patients do come to institutions like BrightView, working with our case managers and our counselors and our team here, operational team, to ensure that we can get them enrolled into, if they're eligible to getting to insurance. Stigma, fear of judgment makes peer-driven and discrete programs more appealing. Flexible care, personalized and non-traditional approaches to fit their lifestyle. Inclusivity, diverse, culturally competent care, essentially for those in the LGBTQ and BIPOC communities and millennials. Mental health integration, how do we ensure that we're able to tackle both co-occurring disorders, whether that be anxiety, depression, bipolar, and dual diagnosis treatment options. Rural and urban access. BrightView is located in both types of communities, and as is plenty of other institutions and companies as well. So how do rural millennials face fewer options while urban ones are dealing with long wait times? So we're trying to fill in those gaps in accessibility to treatment, and certainly privacy, which is a big thing. Confidential services that are highly valued and avoid social and workplace stigma is a huge priority as well for accessibility to treatment. The cultural shifts that in substance use norms, like we mentioned before, there is a decline in alcohol use. Millennials are drinking less and opting for non-alcohol beverages and choosing moderation over binging or over consumption. There is a rise in marijuana use that we have seen because of the legalization and acceptance of cannabis use, often seen as safer alternatives to alcohol and other hard drugs. Opioid crisis impact. The higher rates of prescription opioid misuse and fentanyl overdoses affect millennials significantly. Psychedelic use. This is a growing interest in the millennial population for treatment-resistant depression. Psychedelics such as ketamine or psilocybin for mental health treatment as well. Research hopefully will be continued to be done in those approaches. Mental health link, substance use is often ties to stress and mental health challenges, but millennials are trying our best. We are trying our best to be more proactive in seeking help. Social consciousness of supporting harm reduction initiatives and awareness of health impacts of substance use. Millennials are redefining substance use with health conscious choices, advocacy, and changing attitudes, but continue to face challenges themselves of opioids and mental health struggles. What are some of the effective treatment methods? Certainly CBT helps reframe negative thought patterns and behaviors tied to substance use. It's practical, it's goal-oriented, and it's flexible. It teaches coping skills for triggers and mental health issues like anxiety or depression. Trauma-informed therapy addresses trauma often linked to addiction. It provides a safe, judgment-free space for healing. And techniques such as EMDR resonate with millennials. Other effective treatment methods, peer support approaches, builds trust and connection and accountability through shared experiences. Casual groups such as Smart Recovery or online forums feel less formal. And using and leveraging social media apps for ongoing support. Narrative therapy, exploring personal narratives and reframing perspectives. Enneagram therapy, identifying 9 personality types, each with unique triggers, fears, and coping styles related to addiction, and helps individuals understand why they turn to substances and hopefully to develop personalized recovery strategies. The therapeutic relationship, acknowledge achievements no matter how small. Times have changed, and the old roadmap to success no longer applies to everyone. Celebrate how far they've come, even if this is their first step. That is huge. And it is very important to identify and really celebrate a patient coming in and seeking the treatment to even begin with. The hardest step, as we all know, is the patient walking in through our doors to even ask for the help. Many of us are also perhaps in our own situations like that, whether it be for other medical related problems as well. But it is our responsibility to potentially seek the help, but certainly acknowledging those achievements that our patients make, whether it be at the 1 week mark, 2 week mark, 3 week mark, month mark, whatever it may be. And saying the words that I always see a smile on patients' faces, I'm proud of you. I think that makes a big difference for patients and the therapeutic relationship to flourish. Focus on purpose and the meaning of recovery, explore values, goals, and long-term motivation. Those patients that are in my particular age group, I certainly work on ensuring that we have explored our values or the goals with them, stepping away from the computer instead of looking at it and typing and actually just looking at the patient and speaking with them. I think it makes a huge difference. That connection that that we desperately are looking for is ultimately realized. Utilizing the collaborative approach, act as a guide rather than an authority figure. I think that, again, that's huge because it allows us in this particular generation to work with our patients in a manner of that we are not their parents and we are not coming from an authority. We are in the same age group as they are. We are struggling from the same struggles they're suffering from. And that, again, hopefully builds a further therapeutic relationship. And work-life balance, supporting and empathizing with stress management in both personal and professional lives. It's reasonable to talk about the work that we do here with our patients, saying, hey, I also need to have work-life balance myself. I empathize with what's going on in your work and with your work as well. And kind of going back to having that relationship of being able to talk about the common struggles that we are both suffering from or dealing with, and working on how we can both mitigate stress and what has worked for you and what can potentially work for them. Next slide, please. These are the sandwiched between the Gen X and Gen Z. It is oftentimes we are referred to as the sandwiched generation. Gen X's unique challenge include growing up in a social environment wherein celebrating in excess was normal. This hard living has taken a toll on us physically, but we are usually so busy taking care of our parents, our children, that we all put ourselves on the help list last, if at all. And then certainly at Gen Z, peer pressure in general is worse due to social media. Constantly seeing people living their best lives on social media while drinking or using drugs put pressure on us to live up to that standard and gives us fear of missing out. No other generation has had this level of peer pressure. Gen Z has also been educated to avoid drugs and been drinking, but too many of us ignore this with a feeling of invincibility. Next slide, please. I can see why the millennials struggle with substance use disorders. cheap legal highs are suddenly available in stores. Add this ease of access at the time when they have even less understanding of what may be illegal substances, this increases the odds of a negative outcome. And then certainly millennials that are powering through. David, the millennial in recovery, says, I know that my story can change the world because back when we were younger, treatment wasn't readily available as it is today. I've had the advantages today because I'm older and wiser, and I can recognize that the longer I waited, the more health issues and troubles I have. I'm glad I found recovery at my age, and with the help of law enforcement and people who intervened back then when people shunned people like me in my generation. I was raised to believe that you have available tools, then use them. These are some of the other therapeutic dialogues with our millennials that we've had. Text me or use the online check-in if you ever feel you need some extra support between sessions. Your recovery should fit your life, not the other way around. Let's find strategies that make sense for you and your goals. Let's focus on what you're gaining in recovery, not just what you're leaving behind. Slide, please. So, final recap, treatment barriers, cost, stigma, and time constraints limit access to care. Digital and flexible options are needed. Hidden addictions, many function well in our jobs and relationships. However, delaying recognition and treatment have adverse effects. Effective therapies, millennials benefit from CBT, trauma-informed care, and peer support and harm reduction. Millennials are transforming the conversation around drugs and alcohol with use evolving preferences and attitudes. We are more aware of health risks and prioritize moderation and wellness. There is a growing acceptance of alternative treatments and harm reduction strategies. Despite these positive shifts, we continue to face challenges, including the opioid crisis and other mental health struggles. Thank you very much.
All right, with that, we are going to get started with the Q&A portion of today's discussion. Feel free to drop any questions in the chat and we will try to get to as many as we can. To start things off, Dr. Asuri, what steps can we take to improve early recognition and diagnosis of substance use disorders among millennials, especially given their unique life circumstances?
Yeah, great question. So there can be strategies developed in various aspects of the healthcare continuum. So integration of mental health and primary care has oftentimes been very successful, where the primary health care providers are able to screen and using screening tools. There is the use of digital and mobile health tools as well, like app-based tools and screening tools and AI-driven mental health platforms. Text-based or chatbot interventions are also becoming very common. Culturally and generationally relevant messaging, as well of destigmatizing campaigns and help seeking is very important. And referencing that SUD and substance use general is a health condition rather than a choice. Other things that are going on are workplace and university programs where there are anonymous wellness screenings that are taking place on campuses throughout the country. And kind of what we mentioned as well about the trauma-informed and life-specific approaches, whether it be student debt, housing insecurity, or even the gig economy stressors that many millennials face. At the federal level, there are policy initiatives from SAMHSA, CDC, and HRSA that are also funding earlier interventions, recognizing this and targeting the young adults. And certainly telehealth expansion, I think, has been a game changer for those seeking care. Some of the other stuff that we also mentioned kind of already in our slides, but peer recovery supports, leading to these peer-led recovery programs, such as Young People in Recovery, can oftentimes be helpful. And then, like I mentioned before in these slides about focusing on the polysubstance use, recognizing that that SUD is a health condition and certainly tackling multiple issues at once.
You mentioned destigmatizing. Are there any specific efforts that you can think of to reduce the stigma that may delay millennials from seeking help?
I think that the continued conversation through social media and also through institutions like BrightView of kind of reframing what SUD looks like and what SUD is and changing our language on how we approach it, I think is a big thing. So public health, public awareness and education campaigns, the language reform that has happened at the federal level of a person first, non-stigmatizing terminology, again, peer-led and influencer advocacy groups that are also working as well to kind of help those that are in the millennial generation that have now become influencers and hopefully using their platforms to help people and push people to seek the help that they need. And then certainly, like I mentioned, universities and schools also kind of doing the same thing as well, changing the conversation even in these institutions as well to ensure that people are seeking the help.
As we think about the younger generation, kind of learning from the millennials and even Gen X, what's plagued them, what can we do to help the younger generation feel more comfortable seeking help?
A great question. I think it goes back to that continued open dialogue of bringing continued awareness to this through institutions like BrightView, like other companies that are out there, like our local health departments, public health awareness campaigns that can be driven towards this. Using social media, if we're going to use social media, using it for good, and using it in such a way that we are advocating for those marginalized communities as well of seeking the help that we need. I think if we continue to have conversations going in that direction, I think that it will help the generations coming after us as well, because now we've continued to have an open dialogue about this, which will allow our children potentially to also have open conversations about this versus kind of not doing so and potentially causing further harm to themselves.
Absolutely, absolutely. If there are no other questions, I want to thank you, Dr. Asuri, for an awesome presentation today, and thank you to everyone for attending our virtual forum. As a reminder, you will be receiving your CEC, a link to the recording of this forum, and the slides in a follow-up email within 10 business days. We hope to see you at our next forum, Healthy Families, How to Navigate Addiction Treatment. That'll be taking place next month on June 18th. You will also receive a link to register for that event in the follow-up email as well. Have a great rest of your day.
Thank you.